What is ERP and eating disorder recovery? Have you ever wondered how some people manage to face their fears when it comes to food? One method that has gained attention in the field of eating disorder recovery is exposure and response prevention. This approach, originally designed for anxiety and obsessive-compulsive disorders, has been adapted to help individuals struggling with eating disorders. So, what exactly does exposure and response prevention involve? At its core, this method aims to help individuals confront their fears and anxieties related to eating without resorting to harmful behaviors like binging, restricting, or purging. It's about facing those fears head-on, which can be quite a challenge. In practice, exposure and response prevention involves gradually exposing patients to feared foods or eating situations. This is done in a controlled environment, allowing individuals to experience these triggers while learning to manage their emotional responses. The goal is to reduce the distress associated with these situations and build confidence in handling anxiety without turning to disordered eating behaviors. A key part of this process is creating a personalized hierarchy of feared foods or situations. Patients start with less challenging exposures and work their way up to more difficult ones. This gradual approach helps to make the process feel more manageable. Working closely with a therapist is essential during this journey. Together, they practice facing these fears, which can be incredibly supportive. Developing coping skills is also a vital component. Patients learn how to manage anxiety and emotional distress without using disordered eating behaviors. Exposure and response prevention can be particularly effective for various eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. It addresses not just the behaviors but also the underlying fears that keep these patterns alive. Because eating disorders often involve intense fear around food, this method helps individuals confront those fears directly. This can be one of the most challenging yet rewarding parts of recovery. By facing these fears, patients can regain control over their eating behaviors and reduce the risk of relapse. In summary, exposure and response prevention is a structured approach that supports individuals on their recovery journey by helping them confront their fears and develop healthier responses to food and eating. It's a powerful tool for anyone looking to overcome the challenges associated with eating disorders.